Hi, and welcome back to the Dr. Ramsey Show. We have Dr. David Gallegos with us today to talk more about pain management, the difference between conventional and naturopathic pain management, and then different testing we'll be doing here for patients for free, complimentary, if they want to see what's going on with their joints, a joint issue. So welcome back. I'm so glad to have you. I always am.
Yeah, thank you for having me again. Yeah, this is great.
And our patients love you. They say you're so professional and, really focused and detailed on your work. What he does is pain management. So let's talk about that from the conventional world. Like when people have pain and they go to their doctors.
Right. Yeah, so usually what I see is a lot of them go to their primary care physician. Sometimes they won't even get an exam or a proper physical exam, which is something that we really talked before in our first show about the importance of really finding what the root cause of that pain is, because that can really help me obviously diagnose the pain and the issue with the patient a lot better, and then that way I can tailor my treatment or my diagnostic ordering as needed, right? And so that's the first thing that I see with the conventional, I guess, primary care world, I guess, when it comes to that, and how they manage that. A lot of them too, they just focus on how can we get them out of pain the fastest and the quickest way that we can, right? A lot of it is steroids. So whether it's oral steroids or injectable steroids into the area that's painful. Obviously, sometimes they'll refer them out to imaging or specialists as they need. But yeah, I mean, I think the difference between that and me is that I really try to find that root cause of what's causing the pain, and with our naturopathic approach into a general consult, if you will, we can really find, is it a nerve issue? Is it a stress related issue? Is it a muscle tear? Is it a trauma or an injury to the site? Or is it just prolonged long-standing injury from overuse, whether it's athletic overuse or work-related overuse injuries, right?
Poor posturing, things like that. And so the reason that our first choice is not steroids, in my belief, because again, this is not my specialty, is because it degrades the bone more. It's not really healing. It's making you maybe pain-free if it's working.
Right.
But it's actually degrading the joint space.
Yeah. So it really does a lot of that newer, and it's really not that new. It's been around for over 10 years, research really supporting the aspect that steroids inside of a joint or inside of a tissue really do wear down that tissue even more, and they make it more weak. So then that issue will become worse at the end.
It'll become a surgical issue.
Exactly. Yeah. So really, the only patients that I refer or that I do, because I do sometimes inject steroids, right? There is a time and a place for that. Yeah, but it's let's say that we have someone that couldn't get into with their orthos. They already are scheduled for surgery, let's say a year out, and they're, really uncomfortable, in a lot of pain. Really, the goal is to get them out of pain in the meantime while they're waiting for their surgery.
Yeah.
Right?
And one thing I read, I wanted to see if you ever did this, is that when you do a steroid shot, if you do BPC 157 with it, you prevent some of the damage from the steroid. I just read that in my training.
Yeah, that's a good one. Yeah, BPC is a great peptide that I use pretty often with sort of that adjunct recovery, with all that stuff. So yeah. So but with the steroids, you can really, a lot of the also research shows that a low dose steroid could actually be beneficial to calming down that inflammatory pathway on that area that's been damaged, so that it can heal properly without causing those long-term effects.
With effects?
So the chondrolytics, or the damage and the wear of that tissue, whether it's cartilage, muscle, tendon, ligament. And so that I sometimes also inject, right? Because, it's very tailored and very specific to what the patient
learning
is
something about
going
you
through it,
And it makes sense. Makes sense.
Yeah.
So then you are doing complementary imaging on the third Tuesday of every month. And the images and ultrasound.
Yep.
That you have an ultrasound tech come with you to do the image for you. Tell us more about that if people want to sign up for that.
Sure, yeah. So, what we're offering is every third Tuesday of every month in the morning from 10 to 11:30. Patients can sign up. It's a 10 to 15 minute scan. we're really only allowing one area of concern per appointment. And so what happens is the patient schedules, they come. And so myself and my ultrasound tech, she has over 25 years of musculoskeletal experience, and she has a background in physical therapy. So she's really, really knowledgeable into that aspect. And she obviously can also diagnose, right? Which is a big thing. Because I myself also use ultrasound in a lot of my injections, but I use it for guidance, right? So I use it so that I know exactly where I'm placing the needle, and I know exactly where I'm injecting whatever substance we're injecting. But for her, the benefit of her being here is that she can tell me, there is for example, a tear on the rotator cuff, that it's completely torn, or is it partially torn, or is there inflammation, bursitis. A lot of these issues and pathologies that we see really common in a lot of those pain conditions that people have. And the nice thing with that too is that we can do a functional assessment as they're being here, right? So we can see under the ultrasound how their joint is moving, how that tissue is translating through those movements as they're moving their arm in the shoulder example. So that can be even more informative than just doing, for example,
static test.
Yeah, exactly. Whether it's
cool.
an X-ray or just an MRI, right? Which is just that very specific point in time that they take those films, and that we can only see at that moment, at that specific placement of that limb.
Right. And then that would guide you on the best therapy.
Absolutely. Yeah. Because that can really tell me, there's a lot of inflammation. What we can do to reduce that inflammation, is there a lot of weakness into the ligaments or joints? Is there a tear? How significant of a tear is, right? Because if we're, let's say that we have a patient with a supraspinatus tear, which is one of the rotator cuff tendons. And if it's completely torn off the bone, there's nothing regeneratively that we can do. That's a surgical case. Right. Yeah. That's a referral surgery, so they can get it reattached into the spot. So that can save patients, a lot of money as well, right? Because by us having that information, we can avoid unnecessary treatments.
Yes, exactly. And do the best treatments at the same time.
Absolutely. Yeah. And we can also obviously complement their recovery. Speaking from experience myself, right? I had that big elbow fracture at the end of last year. And so obviously knowing what else I can do, I was doing a lot of those, the peptides that we know, including BPC, CJC and epimuralin. We were doing hyperbarics here in the office, which is a great add-on really to any pain condition.
Yes.
And, eating well, maintaining good hydration, vitamin C, aminos, all these things that we can also, help and guide that patient.
Yes.
Even as they're going through surgery. So it's not like I can't help you with anything in terms of, local aid, but we can certainly do and complement the surgery so that you have a better outcome.
Absolutely. Right. Absolutely. And I like what you said too, because the healthier the patient is, the better response they're going to have.
Yeah.
Like if we have a patient, which we don't really, who doesn't take care of themselves, doesn't think about their sleep, doesn't think about their food, doesn't exercise, that's really not our patient population.
Yeah.
And so I think that's why you get such good results, is because they're already in a healthy state.
Exactly.
Even injury or, something like that.
Absolutely. Yeah.
Right. But all those things you said go without saying.
Yeah. And so going back to that ultrasound perspective, it's been around for many, many, many years. A lot of people really know an ultrasound for an OB perspective, so during pregnancy. But it's a really good tool, really, to identify and to find these areas that are damaged. And,
soft tissue.
And soft tissue, joints. We can look at a spine and we can see if there is any signs of arthritis already forming in those intervertebral spaces. Is there a sign of misalignment, or is there anything else kind of around that area that we can identify?
So I didn't think about the spine. So an ultrasound of the spine can show a herniated disc?
I wouldn't say necessarily herniated disc, but we can certainly see inflammation. We can see arthritis, and we can see the tissue around the spine, right?
That makes sense.
Which is something that I really treat a lot within my my spine injections for regenerative, because let's say that somebody has a herniated disc, and that's really the cause of their radiating pain down the leg, or it's already affecting them in different ways, then obviously we will treat that area, but we also treat the surrounding structures, right? Because what they need, and what really a lot of the reasoning for disc pathologies or issues is weak ligaments, weak really back in general, right? Weak abdomen.
Spines, yes.
I look at the abdomen or the low back as a box, with the low back and then the abdomen being complementing each other. So when you have weakness in one area, that's going to translate to the area behind, or vice versa, So really focusing on all those other structures that are surrounding that area that's been damaged, and that really will help a lot when it comes to that proper healing after.
Functional holistic pain management. I love it.
Yeah,
I do.
Yeah, absolutely.
Yes, and I think it's great for you to come in and just meet Dr. Gallegos if you'd like to get an ultrasound tomorrow, Tuesday, April?
April the 18th.
Okay, so tomorrow, April 18th. If you haven't signed up, please call. You can't come in and expect an appointment to be available, so please call ahead and schedule from 9 to 10:30. Do I have the times right?
10 to 11:30.
10 to 11:30?
Yeah, 10 to 11:30. Yep.
On the third Tuesday of every month.
Right. Yeah. And then just quickly, the price for usually an ultrasound, MSK ultrasound, it's around $150, $200 cash pay. So again, just another thing that we're really providing to really help our patients here at the clinic to get that extra, and they don't have to go to a site to get the test. They're coming here to a clinic that they already know, they already feel comfortable coming in here, and the tech experience wise is really unparalleled to what you can get out there.
So the price of the ultrasound in-house would be $200, but on the third Tuesday they're free. Is that what we're saying?
Correct.
Okay.
Yeah, they're free scans. Correct. Yep.
All right. Thank you so much.
Thank you.
Exciting to have this for our patients.
Yeah, excited to continue with that. Yeah.
Thank you so much. Thank you so much for listening. We'll be back next week. Have a great day.